She Thing, presented by Northwell, who believes when we raise health, we raise everyone. Northwell, raise health.
These two women are connected way beyond these exercises.
You have more motion in your right arm, so you're going to use your right arm to help bring your left arm back until you feel a stretch. Going to hold for 5 seconds. You feel the pull?
Yeah.
Elizabeth Speed, a physical therapist at Northwell Health Stars Rehabilitation, was diagnosed with breast cancer over a year ago. Her patient, Melissa, is now undergoing treatment for the disease. Elizabeth recounts the days she found out her diagnosis after a routine mammogram. Take us back to a moment in time that caught you by surprise, what I tend to call oh my moment. Oh my.
It was very frightening, very scary. I remember taking the call at work and removing myself from the floor when I was treating patients, and I just cried.
And Elizabeth says that's when she received the best piece of advice from her supervisor.
She was one of the first people to say, here are some of the doctors, go see Dr. Tanna.
Tell us about Liz.
So Liz is a physical therapist who came to see me with breast cancer, and like many patients was overwhelmed.
What did you do for her?
We did a double mastectomy and her own tissue reconstruction here at Northwell Health, and she did great.
Emotionally, there was a match needed, that Tanna met a need. What need did he meet inside of you emotionally and therefore physically?
I think knowing the comfort that he gave me, knowing that he was going to be alongside through this entire journey, because it's not just the surgery.
And what was interesting is when I met Liz, I tried to give her some sense of comfort by saying that you will find some meaning at some point in your journey going through this.
And that meaning took Liz to new levels of learning as she soon sat in on the exact procedure she had to get more understanding for her own patients. Weeks later, Dr. Tanna referred one of his patients, Melissa, to physical therapy.
I referred her to see a physical therapist. Now, I didn't pick Liz or, just referred her like I would for any patient.
That patient, a single mom, just like Liz, recovering from the exact same procedure, ended up on Liz's patients list.
And I said, Liz, I told you, right? This would come full circle for you, and sure enough, it did. And that was kind of that defining moment where we pay it forward.
Knowing that she was a breast cancer survivor, I felt like I can share my journey and story with her, and just knowing somebody who has gone through it as well made it easier to go through the process.
I feel that this is almost a gift now.
Melissa says the two are now connected, not only by this gift, but also through the shared journey of healing.